Hi there! Let's talk about the microscopic examination of urine sediments and the diseases that are related to them. The microscopic examination of urine sediments is an essential part of the urine analysis as it enables confirmation and clarification of urine dipstick findings. It also allows the identification of structures that are not evaluated by the urine dipstick. This includes the red blood cells, the white blood cells, and epithelial cells from all the levels of the urinary tract as well as the crystals and caps. Hematuria may be grossly visible or microscopic. Microscopic hematuria is commonly defined as the presence of 2 or more red blood cells per high-powered field in a spawned urine sediment. Isomorphic red blood cells have an appearance similar to erythrocytes in the circulation, which are small and nucleated and biconcave discs and can be seen with any cause of hematuria. By contrast, dysmorphic red blood cells have altered morphology and their presence is suggestive of glomerular disease. The first step in evaluating unexplained hematuria is to distinguish between glomerular and non-glomerular causes, which may involve the kidney and the bladder. Glomerular causes of hematuria are mostly due to glomerulonephritis, which is the inflammation and damage of the glomeruli. Glomerulonephritis is further subdivided into proliferative and non-proliferative glomerulonephritis. Proliferative glomerulonephritis may present as acute renal failure, or proliferative glomerulonephritis can present with nephrotic syndrome, which includes hematuria, hypertension, oliguria, red blood cells, CAS, and mild to moderate proteinuria. Non-proliferative glomerulonephritis may present with proteinuria or hematuria or with nephrotic syndrome, severe proteinuria, edema, hypoalbuminemia, hyperlipidemia, and hypertension. Non-glomerular causes of hematuria may come from the upper urinary tract or the lower urinary tract. Examples of hematuria from the upper urinary tract includes renal stones, pyelonephritis, and tumors of the kidney. Examples of hematuria from the lower urinary tract includes UTI or urinary tract infection, enlargement of the prostate tumor, and surgical instrumentation. White blood cells in the urine include neutrophils and eosinophils. Urinary neutrophils are commonly associated with bacteria. However, if corresponding urine culture is negative, which is known as sterile pyuria, then interstitial nephritis, which is the inflammation of the interstitium of the kidney, of renal tuberculosis, and nephrolithiasis should be considered. The presence of eosinophilia has classically been considered a marker of acute interstitial nephritis. Epithelial cells may appear in the urine after being shed from anywhere within the genitourinary tract. Thus, epithelial cells are often a normal finding in the urine. In some conditions, such as those associated with tubular damage, you may see increased number of epithelial cells in the urine. In proliferative glomerulonephritis, there is an increase in the number of cells in the glomerulus, including an increase in the number of endothelial cells in the capillaries, epithelial cells from the Bowman's capsule, and mesangial cells in the interstitium of the glomerulus. However, proliferative glomerulonephritis patients often have the same number of epithelial cells in their urine as normal patients, so the number of epithelial cells in the urine can be used for the diagnosis in this case.